for stopping the spread of COVID.
Right.
Okay, doke. That's long enough, I think. Lynn, do you want to take us away?
I'll start the meeting. I'll leave the introduction to you, sir.
Great. Ding of the bell. Well, folks, we have Russell Faust back with us. We had a great meeting with Russell last year. Did a great job. I thought it would be timely if Russell came back and gave us an update as we progress into a normal world again, hopefully. So Russell,
Thank you.
I'll let you take it away and
Thank
introduce
you for the
yourself.
invitation.
No
Have you all
problem.
been vaccinated?
I have.
Still waiting.
Not so far.
Yeah, so I will tell you, we have something like 500,000 people on our waiting list, our Save Your Spot list.
Wow.
Oh, no.
It's a little overwhelming, you know, when we think about it, but I don't know what that number actually ends up being when we deduplicate, because a lot of people thought of the Save Your Spot, our waiting list, as like analogous to a lottery, thinking that if they signed up 10 times, they would increase their chances.
Oh, no.
And that's not how it works. So there are
No.
quite a few people who have multiple forms submitted through the Save Your Spot. So my recommendation is, of course, that you go to Oakland County Vaccine, not vaccines, but oaklandcountyvaccine.com, click on the blue button, fill out the form, save your spot on the list. In addition, most of us who are, how do I say this, more mature, have health issues. And because of that, we have at least one or two specialists in our medical lives. Those specialists routinely have appointments in multiple health systems. That is, you know, a gastroenterologist or a rheumatologist will have an appointment, will have privileges at Beaumont and Henry Ford and Providence and St. Joe's, okay? And
Yeah.
because of that, the person that uses that specialist has the ability to sign up at those hospitals. I will tell you, those hospitals are all receiving and have been receiving more doses, that is more vaccine numbers, than we have at county. So to give you a sense of that, and I think I have the numbers here, excuse me. So according to the state's COVID-19 dashboard, those in Oakland County have received more than 250,000 doses. Just over 253,000 doses have been given in Oakland County residents. Excuse me. 55,000 of those doses were given by Oakland County. So the majority are being provided, are being administered by our partners in the community, the 4 or 5 health systems, as well as various pharmacies, as well as the FQHCs, the federally qualified health systems like Honor Community Health, etc. So no matter what, you have a greater, perhaps a greater opportunity of being called by one of those folks. But that's not to discourage you. You know, we're all about vaccinating. If we received the bulk of the vaccine, we would be getting into arms. This is what public health is prepared to do. This is what we do, is mass vaccination. But the state has been doling it out to the to these other partners. I will tell you that, let's see, right now, I'm looking for the number, I believe 46%. So here we go. Nearly 109,000 doses have been given to Oakland County residents over age 65 and older. So that's about 44% of all the doses that have been provided. I see that as good news. Let me just quickly review just the general numbers, and you know, as discouraging or demoralizing as this can be, there are some some good data points in here. There is some good news. There's a little bit of a silver lining to the pandemic, if that can, if you can believe that. So here in Oakland County, we've had nearly 64,000 total cases. We've had not quite 1,600 deaths. We have nearly 60,000 fully recovered, which is a wonderful thing.
Great.
We in county kind of look back on March, April, May as kind of the nightmare scenario, primarily because we didn't have a clue what was going on. There was no precedent, and the hospitals really had no clue what was going on. And with the increase in case numbers, diagnoses, we also had 2 weeks subsequent to the peak, there was an increase in fatalities. So back in March, April, May, our peak numbers, that is kind of a 7-day average, moving along as a 7-day average, the peak number on average was over 300 new cases per day.
Huh.
Seems like a lot. 2 weeks after that, we had a peak in fatalities. The hospitals were struggling. It was literally wartime medicine, war zone medicine. They were lining up gurneys of patients with COVID too deep, too thick in the hallways in the emergency rooms. They were cannibalizing operating rooms in places like Children's downtown to pull the rest of the ventilators out and use them in other rooms, converting them into ICUs. In fact, I had a little girl with tuberculosis of the spine, and she needed surgery. And I was begging the orthopedic surgeon to take her down to Children's because it's just, it's better care for a kid to be cared for in a real children's hospital. The nurses are focused on that, the docs and anesthesiology, everybody's, all about taking care of kids. And he couldn't because there were no ventilators in the operating rooms at Children's. Okay. War zone medicine,
Yep.
March, April, May. Let's move on to November. So I was telling you, we had a peak back in March, April, May, 300 in some cases. November, 809 cases was our peak. New cases per day. Now, granted, we certainly don't have all the testing we need or would like, but we certainly have more testing now than we did back in March, April, May. So that may be a big difference. But here's the really big difference, the significant difference, and this gives me great hope, is back in March, April, May, like I said, after that peak, we had a peak, an average daily fatality number of not quite 30 per day. 25, 30 people were dying every single day from COVID back then.
Yep.
In November, we peaked out. The greatest number we had, deaths per day, 8. And that has continued to trend down. We haven't had a fatality due to COVID since the 15th. What's today's date? So for 10 days, we haven't had one fatality. Okay. It's a
Awesome.
wonderful thing. And our average now is still less than 100 new cases per day. So again, a couple of reporters have challenged me on that number. So it's less than 100 new cases per day. Isn't that because we're just not testing as many, Dr. Faust? Well, we're certainly testing more than we were back in March, April, May. Granted, we may be testing fewer now than we were 4 months ago on a daily basis. People have just sort of given up. I don't need to be tested, But here's the good news. Even when we test, and we're testing a lot, the percent of people that are positive is very, very low. CDC and World Health Organization tell us that the goal is to have fewer than 5% of our population, our community, fewer than 5% to prevent transmission, widespread transmission. We're at like 3.3% right now. So all good news. So, and the question is, why aren't we having those fatalities right now? And I think the answer is that frankly, our hospitals are so good at this now. You know, we have remdesivir, we have antiviral that's, you know, maybe effective. But in addition, what they learned from early on experience, remember back in March, April, May, Italy was on fire. They were about 2 to 3 to 4 weeks ahead of us where we were, and we caught up. But what they discovered was that, unlike, say, influenza, the people that were not dying were the ones you expect to die from flu. They were the immunocompromised. And so they discovered that those folks with, you know, cancer, HIV, immunosuppression from various medications, anti-cancer medications, they were doing just fine. They were not the fatalities. And so we realized that the fatalities were a result of our own immune systems just flooding the lungs and just ravaging the tissue while it's trying to kill the virus. So now, if you get hospitalized with a severe case of COVID-19, you hit the hospital door, they take you in, they're going to give you antiviral, they're going to suppress your immune system. They whack you hard with high-dose steroids and just suppress that normal response. And also there's some issues with, once you're on a ventilator, they're much better at managing these patients now. So, you know, they're just phenomenally good at this. And that whole, in our area here, that whole kind of lesson about immune management really started at the Ascension Southfield, Providence Southfield, and it's sort of just become the standard in this area now. I think it's standard globally. So that's all good news. I mentioned influenza just briefly, and I want to go back to that only because it's a bit of the silver lining. So one of the few benefits of having this pandemic is that masking and distancing and better, and better, you know, general hand hygiene has been great for all the other respiratory viruses. Okay. So we have had, and this is amazing. So since September, during the peak of the influenza season, we've had 4 confirmed cases. That
You went on mute there.
that's
Russell,
weird.
there you go.
Okay. So we've had 4 confirmed cases of influenza since September.
Wow.
It's just insanity. That's just crazy. And so we're not seeing the usual transmission that we see of, you know, influenza, all the other respiratory viruses, adeno and RSV and the common cold. It's just why do I keep going on mute? That's bizarre. So that's wonderful. That's the silver lining of this whole thing. Really nice.
Yeah.
I wanted to talk a little bit about, you know, I mentioned kind of the numbers that we're dealing with in vaccine. I wanted to talk, you know, you're going to be hearing about an explosion really of vaccine availability very shortly. At least I hope we are. I will tell you that in Oakland County, we've had the capacity to vaccinate about 20,000 people per week. And yet, since we've been getting vaccine, we were receiving maybe 2,000 doses per week. And with, you know, 400,000 or 500,000 people on the Save Your Spot on our waiting list, that's pretty frustrating for everybody.
Yep.
However, we vaccinated a little over 18,000 folks last week. We have about 20,000 we're vaccinating this week. And I look forward to, and you know, the frustration is state doesn't know how much is going to be allocated to state until Friday. So we won't learn how much we're to receive next week until tomorrow, Friday. And it makes it's very challenging to be able to kind of at last minute begin
Yeah.
to schedule people, right? So we learn tomorrow. We already have Saturday and Sunday completely booked up, but we learn tomorrow what we can start to schedule, start to make appointments for next week. And the biggest frustration is there have been times when, we were ready to vaccinate 15 to 20,000, and state, because of what they received, pulled back and sent us 6,000. And then, if we had been kind of proactive in scheduling people, then we have to make a bunch of calls and cancel and reschedule. So that has been
That's
that has
not
been a
cool.
challenge. So right now we have EUA, emergency use authorization, for both Moderna and Pfizer vaccines. They're virtually identical. They differ slightly in the way they work, or the way they, does everybody understand how the mRNA vaccines work? I'd be happy to review them, briefly.
No, I'd be happy to listen again.
Yeah, I mean, it's truly a remarkable process in that most other vaccines are amplified up. They amplify the virus by growing them in eggs. And you may have seen these, vaccine factories where they have racks and racks and racks of chicken eggs, and they've been inoculated with the virus, and they let that grow up. And then in order to make whatever the vaccine is supposed to be, so there are multiple types, but if you're going to use, say, a live attenuated virus as the vaccine, then they crack all the eggs open, they dump them into a big mixer, and they try to purify out virus from all the egg products. And this is why, and they do the same thing if they're just going to make up a vaccine out of viral proteins. They dump all that egg mush, and then they purify out the virus in viral proteins. They separate them out and purify them and try to make a vaccine out of that. And here's the problem. When you have that process, invariably, no matter how careful you are, because this is a very expensive process, no matter how careful you are, you end up with egg proteins in that mix, in that virus, and you end up with viral proteins potentially that you don't really want in there. If you're trying, for example, to make a vaccine strictly out of, say, spike protein for SARS-CoV-2, COVID-19.
Hi, Mary.
Oh, hello. It can be a challenge to end up with a pure product to use in your vaccine. Now, the beauty of the mRNA vaccine is that they select just the message, the mRNA, that encodes for that spike protein. And they wrap it in a lipid nanoparticle and inject that as the vaccine. That's taken up by our cells in your arm. And our protein synthesis machinery reads that message and reels off copies of spike protein, spits it out. And then our immune system says, hey, that ain't normal. It makes an immune response to it. That's a beautiful process because it is so much safer than any of the ways we historically make vaccines. I mean, I'm looking forward to a time when this is the standard means of producing vaccine. It's faster, it's much less expensive, it's easier to modify. That is, for example, the regular flu shot every year, they have to modify that, make that up based on the most prevalent strains of influenza that are sweeping the world at the time. And so this is the very best solution. It's the very best method. And it's, yeah, I just love mRNA vaccines. Now, if you haven't already, you are about to hear that Johnson & Johnson vaccine is going to receive the EUA, the emergency use authorization. Okay.
Yep.
I'm excited because J&J's vaccine is single dose. And moving forward, I'm looking forward to being able to get out and vaccinate those that are homebound. And I'm talking about those folks who have significant enough medical issues that they simply cannot get out of the house to come to our drive-through or out to Novi Showplace to get vaccinated. Now the the challenge is that vaccinating those folks with a 2-dose doubles the challenge. That
Yep.
is, we need to get back out there. I'll tell you, it is very resource intensive to be able to get a so-called strike team, basically a vaccine team together, go out to a single house at a time to vaccinate a single person per trip. It is unbelievably resource intensive. And doubling that just increases the challenge, of course. So I'm looking forward to having access to the J&J vaccine. Now, these are the numbers. After 2 doses of either Moderna or Pfizer, we have something over 90% efficacy to prevent infection with COVID-19 compared to the placebo group. Honestly, I don't care what the reduction in infection is. For public health reasons, what I really care about is keeping people out of the hospital. That is, I want to prevent severe disease. I want to prevent fatalities. So that's really what I care about, because if I prevent severe disease, there's lots of good studies that suggest we don't get transmission. Yeah, there's a few cases out there of asymptomatics transmitting, being contagious. But in general, the severity of your disease manifestation parallels the risk of you transmitting it to someone else. You're sicker, you're more contagious. Very simple. So the J&J vaccine is overall shown an 85% efficacy against COVID death overall, measured at 1 month after vaccination. I want to talk about this timing again in just a little bit. At 1 month, efficacy against moderate or severe disease is, and this is interesting, 72% in the US, 66% in Latin America, 57% in South Africa. Now, as with most vaccines, it is more effective with time. It's 100% effective in preventing severe disease and death when we measure at 49 days instead of 30 days. We'll soon have, data for when we measure at 60 days, et cetera. And this brings me back to the timing point I want to make. When you do get called or emailed to go in and get vaccinated, if it's for a double, if it's for Pfizer or Moderna, it's important that you get vaccinated. For Pfizer, it's at 3 weeks, 21 days. For Moderna, it's at 28 days. But it's important that you don't go too early. Too late's okay. You can go way later. You can go 6 weeks out if you want. You can go 3 months out if you want, because you'll just continue, even on 1 dose, you'll continue to build immune response over time. And in fact, most of the EU has gone to either single dose with those vaccines, or they've simply scheduled the second dose out at like 3 months, 90 days.
Mhm.
So, I mean, immunity, response to the vaccine depends on how you measure it and when you measure it. And again, we can measure it by reduction in risk of infection. It's a good way to measure it. We can measure it by prevention of severe disease or fatality. It's a great way to measure it. Or we can measure it kind of in the lab by drawing blood and looking at antibody titers of IgA, IgM, IgG, actually looking at antibody levels. And again, that stuff, that more kind of lab-based stuff, clearly increases with time. Now, the native immunity, natural immunity, if you've been infected with COVID-19, clearly is not as strong a response as we're getting from these vaccines. That is, all the pilot data that we have, I wouldn't call it pilot data now. Oh my gosh, we've got millions of people infected globally. Over time, 3 to 5 months, that immunity, that immune response starts to take a dive. We'll see what we get from the vaccines. I don't know how far out we are now. I've lost all sense of time. I don't know how far in we are, but wherever vaccination started first, we'll have long-term data fairly soon. So, but I'll tell you that selection of the spike protein is a great choice. There's a very strong response to it. Now, the J&J vaccine is a form of mRNA vaccine. So instead of taking the message, wrapping it in lipid, and using that to inoculate that as the vaccine, what they've done is they've taken that message and they've stuck it inside, as a cartridge, basically, into an adenovirus. And an adenovirus is something that circulates routinely and causes a common cold, sort of like other coronaviruses. And what they've done is they've shackled that adenovirus so it can't replicate. So basically, it ends up being a Trojan horse that carries, that infects the cell, but can't divide, can't replicate. So it doesn't make us sick. It doesn't get intercalated into our DNA. It just carries the message into the cells. So that's the way the J&J works. The AstraZeneca, which we'll hear about fairly shortly, in terms of an EUA, that uses a similar method. It uses a slightly different adenovirus. Anyway, I think that's all pretty good news. The folks that are being vaccinated right now are, and I have to look at a list because this changes constantly. Healthcare workers, emergency medical service workers, the EMS, the ambulance folks, long-term care, assisted living, skilled nursing facility staff and residents, those 65 years and older, frontline first responders, school and child care staff, corrections staff, frontline workers in critical infrastructure, including food service, agriculture, utilities, transportation. And that's what I have as of 2 days ago. It's probably changed by now. It's pretty hard to keep up with. But even though state CDC and state MDHHS keep announcing broadening of the eligibility criteria, they're not really, they're literally increasing the number of people who are eligible by a factor of 100. They're not increasing the availability of vaccine by a factor of 100. So it's just increasing the number of people who are frustrated.
Yeah.
But again, there are a dozen more vaccines in the works out there somewhere in the pipeline that will be coming online fairly shortly. So I think, oh man, I'm hoping there's a light at the end of this tunnel and it's not an oncoming train. Right now, we are literally in a race to get as many people vaccinated before a variant evolves, a mutation evolves,
Right,
that is completely resistant to vaccine elicited immunity.
Russell, I think Greg had a question. Did you, Greg?
No, I'm good.
Okay, good. Sorry.
That's okay.
I have a question for you, Russell. So my husband's been waiting for the vaccine. He just turned 65, but he's been on the Oakland list. He has a very severe heart condition, and he's been on the list the same amount of time as our son, who is 45. But our son is a principal and an essential worker as well. our son got called. We literally couldn't walk to the show place. So we've been waiting and waiting. He's also on Ascension and Beaumont list. No call from them yet either. So I'm wondering, our son got called for Saturday. And we're like, what? They signed up at the same time. His dad, I mean, even he said, I wish dad had gotten called first. He actually had a research device implanted in his heart in May during COVID, and we all couldn't be there. So we're very anxious to see him vaccinated. And I'm just kind of wondering, did Jesse get moved up the list because he's a teacher and an essential worker, or, one's 65 and one's got, 45? Or is there no rhyme or reason to it?
No, there's a rhyme or reason. Unfortunately, I don't make that rhyme or reason. The other complication that gets tossed in here, aside from those eligibility criteria, those categories, okay, teacher, frontline worker, EMS, whoever. In addition, the complication that gets layered onto that is this SVI, Social Vulnerability Index. Now, this is an index that comes out of the federal government, CDC, ostensibly, and is mandated. It's based on like 15 different factors, and it's used to rank people. And so I don't know where your son resides, whether he, lives with you folks, but a lot of times,
Yeah.
so that the actual address makes an enormous difference. And it's a bunch of other things as well, income of that neighborhood, ethnic, demographics of that neighborhood, et cetera. It's like I said, it's 15 factors. I've got the list somewhere. I don't know what they are, but that complicates things. And so we end up with, situations as you described. And it's frustrating. And I apologize. It's the best I can do. Really. I mean, to give you a sense of what my day or my week is like, and less for me than my epidemiologists and my communicable disease receptionists and my assistant up in the admin suite. But, basically they're taking calls all day, every day from angry people who believe that they should be at the front of the line, and they compare themselves to somebody else. They're, a relative or a neighbor or, a colleague at work, and it just goes on. And it, I get the frustration. I do. Trust me, we are profoundly frustrated. And again, we could vaccinate 20 to 30,000 people every week, and yet we hear of 250,000 doses that are going to waste in the state because they couldn't get them to somebody, or they delivered them, and those folks just logistically couldn't handle vaccinating that many people, and it just and we just need more vaccine. It's that simple. We need more vaccine.
Anybody have a question? Go again, Ginger.
So I have another question, Russell.
I hope it's not as hard as that last one,
Well,
or as embarrassing.
we're just staying home. We just don't go anywhere.
Very wise.
Very, very wise. Yes.
So when we vaccinate children in poor areas who are malnourished and have dysentery
For polio.
with the polio vaccine, sometimes it doesn't take. So where in the United States we might need 5 doses before they're fully immunized against polio, in some of these countries we might need 7 or 9 doses. But it's a different type of vaccine than what you're talking about. Would the new vaccines that are coming out now, would that counteract that problem?
I'm not entirely sure about that. And I don't want to Yeah, I don't want to be quoted on this. The issue is a single dose of Moderna or Pfizer yields a very strong immunological response. I don't know why they ended up at 2 doses each. And I suspect that because there was a time crunch, what they were doing is they were doing pre-trials basically in small groups, and they were trying to quickly, check on the immune response.
Sure.
And they were doing it by looking at antibody titers, okay? And what they ended up with was saying, well, that's not a strong enough response, for antibody titer. We better make this a double dose. And based on other vaccines, they're like, well, we have to wait at least 3 weeks or at least 4 weeks in the case of Moderna. If under other circumstances, they would have been a little bit more patient, a little more chill, and they would have waited to see what the actual clinical coverage was. Okay.
Makes sense.
And unfortunately, they just could not. And so they ended up putting in their application. Well, basically, they ended up putting their application to do the clinical trials based on 2 doses. And now they don't have any choice.
Right.
It would require, literally an act of Congress. It would require the federal government to step in and say, no, it's okay to do a single dose with these. Somebody like Fauci could probably pull this off. No, really. And so if I were running the show, based on the data that's now available, I would say, you know what? Let's just indefinitely postpone the second dose and double the number of people we can vaccinate right now. But we need to roll this out. We need to get serious and jack up these numbers. The only way we're going to put an end to this pandemic is to get widespread vaccination. And I think that's my opinion. That's what I would do. I'm sure the experts have more data than I have access to, and
Sure.
Certainly much more experience. But that's kind of the way I see it. Having all that experience kind of in front of them now, I think the Johnson & Johnson group said, well, what's our actual goal here? What do we want to achieve with this? Let's just put in for a single dose. And that's what they did. In retrospect, Pfizer and Moderna probably could have gotten away with that. And as I said, virtually all of the EU, UK, most of the EU has gone to either just single dose with kind of indefinitely delaying second dose, or the folks that are thinking they'll get more doses, relatively soon, they're just scheduling second dose out at like 3 months out. And in fact, when we follow these people and monitor the immune response, it continues to build over time. It's a very strong response. So I'm just rambling now. I'm sorry.
No, you're not.
Close to
No,
answering your
wow.
question.
Okay, Mary.
Oh, hi. Introduce myself. I'm Mary Newland. I'm actually on council for Farmington Hills.
Hi, Mary.
I've also been a nurse for over 30 odd years, worked in infectious disease. Proud mom of a nurse that just graduated this prior December and worked through the pandemic at Sonic Grace
Congratulations.
Emergency Department.
Thank you, Mary. Thank
Weird
Thank you,
time
daughter.
to enter the field, eh?
Yes, and I've gone to the dark side. I work for United Healthcare. So we've been my team manages Chicagoland down to the bottom of Illinois. So I live, breathe, and live COVID. Because we've had been the honor of reviewing many charts for those who have received lung transplants. So my question is, I was on the call the other day, a couple nights ago, with Dave Coulter. And he talked about of course, is supply and demand. Demand is high, supply is low. And he talked about a number of long-term care facilities, and that fell under the control of the county having to vaccinate like 70 of them at the number of about 11,000
84
people.
of them.
Okay, and so I was trying to figure out, were they facilities that are actually like assisted living, but they don't get Medicare, Medicaid reimbursement, or what was
No,
the?
here's the deal. The federal contract with CVS Walgreens, that was for skilled nursing only.
Okay,
And so there's a fair number of people that live in these long-term care facilities that are, assisted living, they're memory care, you could make a long
Okay.
list, and including independent, but you can make a pretty long list. And there are 84 of those facilities in county that
okay,
basically nobody was going to take care of. And so, their residents certainly meet criteria. They're all 65 and older, but in addition, they're in many in a congregate living situation,
Mhm.
kind of like the jail. If we get positives in there, it's wildfire. And we certainly had those situations back in March, April, May. And we're actually doing fairly well avoiding a repeat of that. And kind of like Ginger mentioned, we don't go anywhere. I got to tell you, folks my age and older are pretty paranoid. I mean, my age has a 10% mortality risk with COVID-19, or certainly does based on historical data. I don't know what it is now. The hospitals are certainly better at managing. But that's not insignificant.
No.
And so we're working hard to get out and take care of these folks. The risk for these people is not them hanging out at home. It's the folks that are coming in to care for them. It's the people that are coming in to clean, and the people that are coming in to help with their cooking or their meds or what have you. And because they're exposed in the world and they're bringing it in. And that's an issue. And so we've been trying hard when we go out. We try to schedule staff in addition to third-party vendor staff at the same time. It can be challenging to reach them all, but when we go out to these facilities, we try to have them all lined up as well, so that we can get their caregivers vaccinated as well. And many of them, because it's kind of gig work. They got a lot of gigs. They're doing this, they're doing that. Some are working part-time at Beaumont. Some are, doing other things. Many of them are getting vaccinated at whatever group practice that they also fill in at, or at one of the hospitals. So that's been advantageous. But yeah, I was shocked to discover that there were those 84 facilities that completely fell through the cracks.
And with a lot of volume there.
Yeah.
A lot of volume.
Yes and no. I mean, that includes some of these group homes. They're down to 6 people in a group home, all the way up to facilities that are, 150, 200, 300 people. So yeah, you're right. We're talking significant numbers overall. And I just want to emphasize that that's how we like to view county health, is to try to fill the gaps. Because there are certainly a lot of gaps that aren't going to be covered by, other federal contracts or other agencies and what have you.
Now, I finally broke through, and I emailed Kathleen, the director, the other day to try, cause I've been trying to find out how to volunteer, not knowing, let's make me available when we do have vaccine available. So I'm actually up to now submitting my security clearance, my background check, and that's as far as I've got. I'm now waiting. So
yeah, so Homeland Security at the EOC, the Emergency Operations Center, they manage vetting volunteers, and it breaks my heart that we have so many volunteers. We don't have enough vaccine. Bodies aren't our biggest challenge right now. I mean, we've got the National Guard. I've got medical students and, nursing students. I've got, we've redeployed basically, everyone at Oakland County Health from environmental health and community nursing in our clinics. We've just basically, focused everything and just redeployed everybody over to vaccine. We've even taken our testing sites, we've outsourced testing because that's a much lower priority to me than getting, you know, vaccine into arms. So we've outsourced testing. You know, we've contracted with an outside lab to come in and manage all of it, you know, the swabbing, everything, all aspects. And we've redeployed all of our personnel to vaccine. But again, staffing isn't the challenge. You know, logistically, yeah, I'm glad it's not my job. That's a nightmare. But, you know, the volunteers are great, but we need vaccine. I mean, we're just desperate for vaccine. Honestly, we have the ability to ramp up, to scale up to at least 30,000 a week. I want to be vaccinating 30,000 people a week. I mean, heck, you know, we could run 10,000 people through Novi Showplace in a day without breaking a sweat. We should be doing that, you know, 3-4 times a week easily. So I'm cautiously optimistic that we'll get there. I mean, nationally, what we're at 1.7, 1.8 million doses a day now in this country. That's awesome. I mean, that's ahead of, you know, Biden's 100-day goal. Yeah, I want it to be more.
Right.
Russell, is there a list for, like, for instance, someone like me who can walk to the show place? People don't show up. You have vaccine at the end of the day. Is there a list that
Great
they're calling
question.
as
There
the
is.
day goes on?
There is. We have a call list. And unfortunately, what has happened, oh, this is so frustrating.
You can't get on it, huh?
No. It's a long list, trust me. What happened is that 1A people, let's just take EMS, for example, right? Or let's take a macho group, sheriffs. Sheriffs sat back originally, you know, and said, vaccine, you know, COVID, it's just like the flu. I'm not worried about it. Or I'm going to wait and see how my buddies do. I know he's going to sign up. I'll wait and see whether he lives. And so that's what happened. A huge number of EMS, sheriffs, etc. And so I guess when their buddies survived, they decided, well, or when some of their, you know, acquaintances died from COVID or got severely ill and hospitalized from COVID, maybe went, oh, I guess this isn't just like the flu or the common cold. And started taking it more seriously and thought, what the heck, I'll sign up. Well, by the time they got around to it, there was 250,000 people on the list. And they don't automatically go to the head of the list. You know, they go on behind any other 1As that are already on the list. So what we have is we have a call list so that at the end of every one of these clinics, and I'll tell you, we're very, very careful with the dosing, okay? You know, pop in another vial. But at the end of every one of these clinics, if we have a partial vial, we get out the list and, you know, we go down whatever 1 or 2 or 3 people down the list and get them in. And it ends up being EMS, a hospital worker, a frontline worker, you know, somebody like that just, you know, was a knucklehead and didn't do it early on when they were offered. You know, I think it was last Saturday, we were at Novi Showplace, and the process now is very, very rigorous in terms of breaking open a new vial. So for the last 2 hours of any clinic, any site, they only draw up enough to meet the number of people in line. They sit there, they watch the line. There's 7 people in line. They'll pop another vial. And so they're very cautious. They don't end up with, you know, I mean, there are folks out there that are, you know, just cranking out the syringes, and they get to the end of a day and they have a bunch of no-shows. They got 20 doses sitting there. We never, ever have that. And we never waste a dose, ever, not one.
So how do you get on that list?
Again, it ends up being a 1A list. And if
Okay.
you're not 1A, you're not on the list.
Okay.
It ends up being the folks that should have gotten vaccinated 2 months ago and hesitated for whatever reason. But, you know, they're still being exposed. They still need to be vaccinated. You know, they're
Sure.
always front line. And I know we vaccinated 2 people on Saturday. One was an EMS guy who was a second dose, and another was a medical student that's, you know, that's actually at our sites. So, yeah,
Eh.
I'm sorry we just don't have more. I wish we did. And, you know, like I said, all week long, I take calls, people crying on the phone that they should be, you know, at the top of the list. You know, not my decision and I can't fix it. All I need is more doses.
Well, folks, before we let Russell go, and again, Russell, I have to thank you for taking a second turn in the barrel. Really enjoy you talking. We get wonderful information every time we do this. So
No,
I'm
thanks
afraid
so
we'll
much for the
probably
info.
ask you later in the year.
Oh, no, please. You know, I try to do updates. Actually, I've been doing the weekly updates for their Facebook. So if you go on the site, you'll get quite a bit of information and data on those recordings. But
That's the Facebook site for Oakland County.
it is. And you
Okay.
know what? I have a heck of a time finding. If I can find it, I'll email you the link, because our site, how can I be diplomatic? It sucks.
Yeah, we've had that problem.
Anyway, thank you very much for the invitation. I really appreciate it.
Any more questions before Russell goes?
Yes, Russell, one last question.
Yeah.
That nurse I was talking about working in emergency department, she's also your president in Miss Oakland County for Miss America. So her platform is actually heart disease. So she's enrolling it into also the effect of COVID on heart disease. So she would love to be able to interview you maybe sometime, or even talk about your experience giving out, you know, vaccines. So she might she may send you an email. So
Anytime.
thank you.
Russell seems to be so reachable.
Popular. Yeah.
And very reachable. He is a
No,
wonderful guy.
Being interviewed by a journalist is the least favorite part of my job.
Well, she's
Thanks, guys.
friendly, so.
Okay. You well. Stay safe, and I hope you get vaccinated soon.
So any more questions for Russell? Again, Russell, many thanks. That was
Thank you.
wonderful.
Good to see you all.
And
Bye.
the recording of this meeting will be available tomorrow morning.
And you stay
Bye-bye.
safe, Russell. We
Thank you.
need you.
Bye.
Yeah, right.
Okay, Lynn, do you want to bring us home?
Are you ready for that?
Yes, we are.
Anybody else have any general conversation they'd like to get into briefly?
Well, Lynn, it's Barry here. Good to be with you again. And
Thanks for joining us, Barry.
Yeah, I hope you think I'm not lurking.
No.
But he's good.
He is good.
He's excellent. That's why
Wow.
I'd bring him back more often, but I think even he would get bored.
I'm
A
amazed.
lot of info.
I'm amazed that he feels as if he's got enough time to talk to us, to you.
Amazing what he does.
Yeah.
So that being said, Lynn,
Yep. Getting to a point here. There we go. We only do about 2 official things, and that's start the meeting and end the meeting. But part of ending it is for whoever attends, they can choose to participate if they wish in reading or reviewing or commenting on the
from memory.
on the 4-way test. And, you know, listening to the presentation today and before, imagine trying to apply the 4-way test in this terrible scenario that we're in the middle of, vaccinating people for this COVID.
Well, thank goodness there's people like Russell.
That is for sure. So for those who know it, we can recite it.
Or those that can see over your shoulder.
A test of the things we think, say, or do. First, is it the truth?
Truth. Second, is
Is
it fair to all concerned? Third, will it build goodwill and better friendships?
Fourth, will be beneficial to all concerned.
Thank you, folks.
So, thank you.
And as I said, the recording of this will be on our website tomorrow morning sometime.
we
And
gotta
if you want to
encourage
tell
people-
anybody else, you can, if you want to tell anybody else to go to the library on our website and view this, they can. That would be no problem at all.
We
Thank
good.
you, guys.
Thank you.
Bye-bye.
Have a good evening.